I'm Dr. Guillem Gonzalez-Lomas. I'm an assistant professor in the Department of Orthopedics here at NYU Langone Health, and I'm in the sports medicine division. My specialty is sports medicine, and in the world of sports medicine, we really generally are focused on the joints. And what I'm looking at is problems related to cartilage, to tendon injuries, and to ligament injuries that occur in any of those joints. A large part of my practice is arthroscopic, which means that the surgeries that I do are minimally invasive. So we use a very small fiber optic camera to get in the joint, and then other small instruments to do the work inside the joints. What I love about orthopedics is twofold. One, it's a specialty that has some focal problems that we can solve. So problems with solutions. But then the other aspect that I really liked about orthopedics was how team-oriented it was. You really can't be an island. You have to work as a team in the operating room, in the office, and the patients kind of become part of that team. The Sports Medicine Center is this kind of incredible grouping, this amalgamation of world-class specialists and providers that allow patients to receive care in a one-stop shop. We have everything from physical therapists, occupational therapists, psychologists, nutritionists, exercise physiologists, surgeons, non-operative physicians, all under one roof. We are constantly comparing notes, we're talking about cases with each other, and we're really applying all of our minds to solve these problems. When it's laid out, when it's mapped out, when you say, look, other people have gone here before, they've succeeded, you're next, you're going to be okay. And that, I think, comforts patients, especially in those cases where the diagnosis is going to require more significant intervention.